Quality of life. That is what so many cancer patients want to have. We've got Matthew Whittick here. He's the medical director of the Maryland Proton Treatment Center. Welcome back to Midday Maryland. We appreciate having you here.
It's my pleasure. Thanks for having me.
So tell us a little bit about it. You talked with us before about the quality of life issues that accompany proton therapy. Can you remind us about that therapy and how it helps to preserve that quality of life for people who are battling cancer?
Sure. So proton therapy is an advanced form of radiation therapy. It's slightly different than traditional radiation in that we're able to deliver the same amount of cancer-killing radiation to the tumor, but decrease the dose to the normal tissues surrounding the tumor. And by doing so, we limit the toxicity patients experience during the treatment and afterwards.
Okay. So you specialize in cancers of the head and neck, I believe. And so can you explain more about that and tell us how those cancers in particular can be treated with this proton therapy?
Sure. So head and neck cancer is, if you will, a constellation of tumors that develop below the brain and above the collarbone. So for example, your thyroid gland or your tongue or your throat, those are what we consider head and neck cancers.
Got it.
So head and neck cancers, if you imagine where they begin, are really close to very sensitive structures. So your tongue cancer is right next to your salivary glands and your taste buds. Mm-hmm. So the radiation we use to cure your tongue cancer also can affect your salivary glands and your taste buds. This can cause you to have, for example, loss of taste or a dry mouth during the treatment and then after the treatment. Proton therapy reduces dose to these structures, so you can expect a lower risk toxicity during your treatment and then afterwards.
Okay, and that's just because it is so targeted, correct?
Correct. So we deliver the same amount of radiation to the target, but the way the proton works in the body is that the normal tissue surrounding the target gets less dose.
Got it. All right. So what are the side effects from that traditional radiation that can be avoided with the proton therapy? Is it really just that you're not interacting with different parts of the body that don't need to be targeted?
Sure. So it depends on the target that you're aiming at. So for example, head and neck cancer, the sensitive structures are your salivary glands, your taste buds, your swallowing muscles, your thyroid gland. So those are all surrounding the target that you're aimed at with your proton therapy. And so all these structures can cause side effects. For example, like I mentioned before, loss of taste, dry mouth, difficulty with swallowing. All of these are reduced with radiation delivered by proton therapy compared to your traditional radiation therapy.
And just so we know, how often should we be getting screened for these cancers?
So unfortunately, there's not a great screening protocol for head and neck cancer. But fortunately, if you develop a cancer of the head and neck, you can see them, you can feel them, they cause you symptoms. So the key here is really to just not ignore the symptoms and see your provider as soon as you notice something that seems a little bit off.
And where can people go to learn more about proton therapy if that is a therapy that they might need?
Sure. We have specialists that do head and neck cancer as well as all the other disease sites. So for example, breast cancer, prostate cancer, lung cancer. If you're diagnosed with any of these cancers, we're happy to set you up to see one of our specialists. If we can help you, we will. If not, we'll find somebody that can. Our phone number is 186-MD-PROTON, or you can go to our website, askforprotons.com.
You know, it's amazing. I've been doing this show now for a little over 4 years. And just to see, even in that time, how much these treatments have come along and how expansive they are is really, really remarkable. You're doing remarkable work for us here in Baltimore. So we appreciate it, Dr. Whittick. And we'll be right back with more Midday Maryland right after this. Stay tuned.
Thank you.